tomorrow you are having exam but still confused about the short-term regulation of blood pressure? Come on, let's finish it in 5 minutes. Now before going further, let's have a look at this very important diagram of baroreceptor reflex. Why it is called as a reflex? Because it is having a stimulus, high blood pressure. Now this stimulus stimulates two important baroreceptor, one in the carotid sinus and second one in the aortic arch. This stimulation of baroreceptor carry the impulses through two important nerves, that is the 9th and 10th cranial nerve to Vasomotor Center, that is in medulla, that is a nucleus of tractus solitarius. Now it causes decrease in sympathetic stimulation and increase in parasympathetic stimulation. The effect is it causes vasodilatation and bradycardia, that is a heart rate decrease. It overall result in fall in the blood pressure. Remember, that is the entire sequence of short-term regulation of blood pressure. If you master this, your half work is done. We are going to cover the entire short-term regulation under 5 headings. First, definition and normal value, baroreceptor reflex, chemoreceptor reflex, CNS ischemic response, and lastly the applied aspect. This we are going to achieve through 3 flowchart and 1 diagram trick. So let's start with the definition and normal value. Definition. Blood pressure is defined as the lateral pressure exerted by the moving column of blood on the wall of the arteries. So here you can see blood pressure is the product of cardiac output and the total peripheral resistance. Here we are having two important components. One is the systolic blood pressure and the diastolic blood pressure. Systolic blood pressure, it is the maximum force, that is the pressure applied during systole. The value is 120 plus or minus 20 millimeter of mercury, and it is mainly driven by the cardiac output. Second one is the diastolic blood pressure. So it is the minimum pressure recorded during diastole. The value is 60 to 90 millimeter of mercury. It is mainly driven by the peripheral resistance. Remember, it decides the coronary filling. Along with this, there are two important derived pressures. Those are also very important. First one is the pulse pressure. It is the difference between a systolic and diastolic blood pressure. So 120 minus 80, it is 40 millimeter of mercury. Where the next one is the mean arterial pressure. The formula is diastolic blood pressure plus 1/3 of pulse pressure. That is 80 plus 1/3 of 40 millimeter of mercury. That becomes 95 millimeter of mercury. Remember, this mean arterial pressure is not an arithmetic mean, but it is a geometrical mean because the diastole is longer than the systole. Now this table shows all the factors affecting blood pressure. Remember, the factors like age, exercise, emotion, stress, blood volume, viscosity, and cardiac output, they are in direct proportion to the blood pressure. That is, if these factors increases, the blood pressure increases, except one factor, and that is the vessel diameter. As the vessel diameter increases, the blood pressure decreases. One exam tip: if you want to save your time, you can write all these factors in this tabular format. Now here comes the main part of the answer, that is 3 short-term neural regulation mechanism. The first one is the baroreceptor reflex. Here, a rise in blood pressure, it causes stretch of the baroreceptors in carotid and aorta. This increases the efferent impulses in 9th and 10th cranial nerve, which reaches the nucleus of tractus solitarius in medulla. Now this stimulation has got two effects. First one, it stimulates the vagal center and it inhibits the VMC pressure area. Now this causes a decrease in heart rate, that is a bradycardia, and also it causes the vasodilatation. So ultimately blood pressure returns back to normal. The second mechanism is chemoreceptor reflex through chemicals. Here the stimulus is decrease in oxygen, increase in carbon dioxide, and decrease in pH. Now this stimulates the carotid and aortic bodies, and it overall excites the vasomotor pressure area. And this causes a systemic vasoconstriction, ultimately leading to the rise in blood pressure. Where the third mechanism is a CNS ischemic response, that is a last ditch or emergency response. Here, whenever the blood pressure decreases less than the 60 millimeter of mercury, so this ultimately causes overall medullary hypoxia, and this leads to the massive vasomotor center excitation, that is a sympathetic stimulation, and this leads to the vasoconstriction or rise in blood pressure. Now in applied aspect of baroreceptor mechanism, you can write about this orthostatic hypotension. Mentioning this correlation secure an extra mark. What is it? When a person stands up too fast, it causes blood pooling in the legs, that is venous return decreases, and that lead to the decrease in blood pressure. Now how it is a act? It acts in a reverse reflex sequence. That is, it causes a decrease or less stretch on the receptors and less decrease in vagal tone, that is parasympathetic stimulation, it ultimately increases the sympathetic tone and causes the vasoconstriction and tachycardia, that is a heart rate increase, and rapidly restore blood pressure to the normal. Here, this table shows main difference between the baroreceptors and chemoreceptors. If you write a difference between baroreceptors and chemoreceptors in this tabular format, you are representing the maximum amount of content in less time. Let's see the difference. Baroreceptors mainly stimulated by the stretch or pressure, whereas chemoreceptor whenever change in the chemical component of blood. Baroreceptor action is inhibits, chemoreceptor it excites the vasomotor center. Baroreceptor causes bradycardia, whereas chemoreceptor it causes tachycardia. And baroreceptor operate within a normal range of 60 to 160 mm of mercury, whereas chemoreceptor act whenever blood pressure falls below 60 mm of mercury. This second diagram shows the operative range of baroreceptors between 60 to 160 mm of mercury. There is one more applied aspect, that is about hypertension and hypotension. Remember, in chronic hypertension, baroreceptor reset in 1 or 2 days to the new high pressure. So that's why blood pressure regulation long term baroreceptor have no role. Whereas during hypotension or hemorrhage, chemoreceptor take over whenever blood pressure falls below 60 mm of mercury to save the brain. So let's revise this entire blood pressure regulation in 60 seconds. First, about the baroreceptor. It causes a rise in blood pressure, causes stage of the baroreceptor, nucleus rectus solitarius get activated, it stimulates the vagal center, inhibit the vasomotor center, and ultimately causes decreased heart rate and vasodilatation, and blood pressure comes back to normal. Whereas in the second mechanism, that is a chemoreceptor mechanism and a CNS ischemic response, whenever the increase in intracranial pressure, the brain artery is compressed and that causes ischemia of the medulla, and ultimately the vasomotor center strongly excite the systemic vasoconstriction, and ultimately there is a massive rise in arterial blood pressure. But remember, though it restores the main brain blood supply, but it also stimulates the baroreceptor and it causes the reflex bradycardia. The hallmark of raised intracranial pressure is high blood pressure along with the low heart rate. With this, we have finished the exam rapid revision of short-term regulation of blood pressure. Remember this formula of blood pressure, it is a product of cardiac output and total peripheral resistance. Mean value of mean arterial pressure, that is 95 mm of mercury. The most sensitive reflex range is between 95 to 100 mm of mercury. What is the threshold for baroreceptor? It is 60 mm of mercury. And most important, the buffer nerves, there is a cranial nerve 9th and 10th. Along with these, remember these all Viva questions. And revise this once before the exam, and also refer to the full topic for complete recall of answer. Thank you.